Well, all righty. Welcome, welcome, welcome. Good afternoon, everyone. My name is James Bennett with Upstate Home Care, and I'd like to welcome you to our Senior Issues Group workshop. This will be our final workshop for the year, and we truly appreciate everyone who has participated throughout this year. I know it's been a challenging year, but yet you saw fit to continue to support us and to continue to learn about those issues that are surrounding our seniors. And we thank you for continue to support 10 at the Top. Again, thank you, 10 at the Top, for being able to put together this workshop so that we can bring groups together from all different disciplines to be able to talk about those things that certainly are dear to us, and that is taking care of our seniors. These workshops would not be possible without the help of our sponsors. The sponsors are the Better Business Bureau, as well as Upstate Home Care, where we essentially assist our clients with their day-to-day needs to help them be able to remain in their home and provide peace of mind to the families on a daily basis. And so that's just a little bit about us, but I know that we are here today to hear from the South Carolina Home Care Hospice Association. We have a great agenda planned for you today, and I'm going to be quiet and turn it over to V, where she could tell you a little bit more about the BBB and then also introduce all of our presenters for today.
If I could just be a little Budinsky, Dean has a brief announcement before.
Oh yeah, I'm sorry, I skipped right over that in the agenda, didn't I?
That's
I'm
okay.
sorry.
That's okay, James.
Turn it over to Dean.
I'll get over it. A few weeks of therapy, and I should be fine. So very quickly, I'm Dean Hebel, Executive Director of 10 at the Top, and I was sharing with the group beforehand that we have been engaging around the issue of seniors and supporting the work of organizations that support and work with our seniors for about eight years in various capacities. And we know that it is a critical area within our upstate, especially as we're continuing to grow our senior population. This committee has kind of been more of an ad hoc in many ways in terms of leadership and involvement over the years, but I am thrilled to announce that we are formalizing that a little bit more with James and V. Daniel, who you'll hear from in a minute, serving as co-chairs moving into next year. Our hope entering 2020 was that we would be not only having workshops around issues that impact our seniors and senior care, but also starting to meet with and create a kind of a white paper and talking points to meet with key influencers around senior issues and people who can help with funding and with increased capacity and things of that nature. And unfortunately, that was somewhat derailed by COVID, but it is something that we still have very much on the radar. And with James and V now as our co-chairs and leaders, I have no doubt that they will make sure we push that agenda forward for 2021, in addition to holding what will at least early on be virtual meetings, and we hope at some point becomes the opportunity to meet in person as well. But I just want to thank both James and V for the support they've provided really for the last couple years around as sponsors of these sessions, but also their interest and involvement personally. And when we were connecting with them to ask them to officially serve in this role, I didn't have to do very much arm twisting. So I very much appreciate that and know that they both are passionate around supporting our seniors, and I think will be great leaders of this committee. So with that, V, I'm going to turn it over to you.
Well, thank you, actually, James, and thank you, Dean, for the warm welcome. And Dean, I just hope that James and I can hold up to your standards, but we'll do all that we can do to keep moving with our senior issues, because I know that we're both passionate about it, and we're excited about it as well. So, not every day that we get the opportunity to hear from a home care or home health or a hospice professional. But today we get to hear from someone that has over 26 years of experience. As the first director of government relations and chief lobbyist for the Association for Home and Hospice Care of North Carolina, vice president of government relations for comprehensive home health care and hospice, which is now Liberty, director of regulatory affairs and strategic planning for Tar Heel's Home Health and Hospice of Tar Heel, and finally, as president and chief executive officer for the Association for Home and Hospice Care of North Carolina since 2001. Our speaker has held numerous leadership roles on boards and commissions. Actually, when I was looking at it, I thought to myself, I need to get to work. He's been a state health coordinator council, home health and hospice representative appointed by the North Carolina Governor, Roy Cooper. Chair of the Council of State Home Care and Hospice Associations from 2017 to 2018. He's a board member, second vice chair of the National Partnership for Medicaid Home-Based Care in Washington, D.C., and he's been doing that since 2017 to 2019. He was appointed in 2018 to State Health Care Coordinating Council, Home Health and Hospice Representative, appointed by the North Carolina Ray Cooper, and reappointed for 3 more years in 2019. So apparently he must have been doing a good job. In 2019, served on Healthcare Association Strategy Partners Board and North Carolina Institute of Medicine Serious Illness Task Force. And in 2020, he was appointed by Secretary Mandy Cohen to North Carolina's Olmstead Act State Advisory Council and North Carolina's COVID-19 Healthcare Task Force. He received his BA in Political Science and History from the University of North Carolina at Chapel Hill. I won't say go Hills, but I have a nephew that would. So without further ado, allow me to introduce our speaker today, Tim Rogers, the President and CEO of the Association for Home and Hospice Care of North Carolina and the South Carolina Home Care and Hospice Associations.
Well, thank you so much. Thank you very much. And let me just go ahead and say right off the bat, do not run away. Do not be afraid. Nobody is coming from up north to tell you what to do down south, because I can tell you, my daddy was born in Dillon, so we have South Carolina roots. I've been involved with the South Carolina Home Care Association since 2005. Wow. So we have strong Palmetto roots. Also, I was appointed by former Governor Nikki Haley to the South Carolina CON Task Force and have served on that for years in Columbia. I also serve on the South Carolina DSS Advisory Board. So I try to balance as much as my time, if you can see in this virtual window, between as much of my time in the Palmetto State as I can in the Tar Heel State. How we got into South Carolina is beautiful because I actually need to update that little chart on the resume. I'm celebrating 29 years in the industry, and we met our friends in South Carolina in working in the Medicare home health and hospice arena, in working with our intermediary, Palmetto GBA, who pays the bills for home health and hospice, based in Camden in Columbia. And we met them in the late 80s and early 90s. Well, about 2000, the South Carolina Home Care Association was managed by a law firm, and they were not doing so well. And they were looking for someone to partner with, someone to really bring them back up to vibrancy. And we seemed to have had a good thing going in Raleigh throughout Maniota Murphy in North Carolina. So they reached out to us to see if we wanted to manage them back in late 2004 and 2005, because they were down to 10 members in the association in Columbia. Well, we reached an agreement. They had about 10 members. Lo and behold, 16 years later, we have over 325 home care, home health, and hospice members throughout the great Palmetto State in South Carolina. And we ain't finished yet. So we've got a lot of work ahead of us. We have really enjoyed the relationship throughout all the regions, the Low Country, the Upstate, the Midlands, everybody that we have met in South Carolina, everyone that we've worked with in the legislature. We started out as a home health association in early 2004 and 5. We branched into hospice and palliative care and brought them in to try to match our continuum that we have in North Carolina. And then when South Carolina, we merged with, at that time, the South Carolina Association of Personal Care Providers, which was a lot of home care. And then South Carolina obviously eventually got home care licensure a few years ago, as you know. Should have long time ago, but we better late than never. And we work really closely with the chapter of the Home Care Association of America. My good friend Vicki Hoke runs that in Washington, D.C. Wanda Crotwell, as many of you know, is the lobbyist for that association in Columbia. So we're really trying to partner with anybody, wherever 2 or more will sit at the table in the name of home care, home health, and hospice. We're there. And we really do everything we can to try to reach out. And when Shannon told me about the conglomerate of this organization and everything that you're doing and the senior resources and the 10 at the top and the 10 counties that you're doing, this is such a natural fit because there's so much that needs to be done, especially in the area of home care, community long-term and behavioral supports, rates, the lack of supportive rates, the low rates that are being paid in South Carolina for community and behavioral support services and private duty nursing and home care, things that we've been trying to change in the legislature in Columbia. We work both sides of the aisle. We have a political action committee. We attended the governor's inauguration a few years ago. We work with the Democratic Party. We work with the Republican Party. Whatever party there is, we'll have a party. We want to work with you. And we want to make sure that we are there to affect change, because at the end of the day, it's about the patient and the client and the family member that's got to be left in the home after that caregiver leaves and after that paid caregiver leaves. And we've got to be able to connect with all the resources like you have. And that's what the association does. We're growing in our home care and private duty and private pay part of our association. There's a lot more growth that we can do. Granted, we are larger in our association in home health and hospice and palliative care, and it's organizations like yourself and partnerships like yourself that can bring us closer together and try to learn about each other, share ideals and legislative agendas and things that we need to know about policy, emergency preparedness, what's going on in COVID, things like that. I'm very proud of the staff that you have on this with me. We are one of the largest 2 associations in the United States of a state association, 3 registered nurses in this association that cover South Carolina, in-house interim government affairs lobbyist, and Julia Adams Sherrick, and Judy Penn is the chief operating officer. She's actually been with the association longer than me, nearly 30 years. We have a government affairs team in Columbia, Copper Dome Strategies. Billy Ruth is our lobbyist. He's our paid lobbyist in Columbia, works full-time for our association to cover all things Medicaid, DHEC related policies, no matter what they are. And so we're a comprehensive organization that supports all types of organizations that does provide in-home services. And we're here to support organizations. We're here to listen. We're here to provide feedback, regulatory assistance, technical assistance. We're also connected with all our national partners in Washington, D.C. And that's about the big 30,000-foot level and down to the 5-foot level in Columbia on who we are. And we have an annual conference every year. If we had been together prior to COVID, we would have been in your backyard. We would have been at downtown Greenville at the beautiful Weston Poinsett. But we can't do that this year. So we're going to be holding a virtual conference this year. And but we want to get to know you more. We want to provide, some of you are members, and we want to provide services. We want to learn more, and we're just here to help. We're here to listen. We're here to learn, and we're here to partner. Thank you very much for the opportunity. And when I leave a little bit later today, I'm here to answer any questions, but you'll be in good hands with the rest of the staff. As I told some of you before the rest of you got on the call, I'll take off one hat and put on another, and I'll be the caregiver of my elderly parents and take one of them to the doctor's office today, my 90-year-old father. So, who was born in Dillon. Again, as I said, who lives in North Carolina. So we have those South Carolina roots, many of us. Thank you very much for this opportunity. I sincerely, sincerely appreciate it. Thank you.
All right, Tim, we certainly appreciate you and what the organization does and what the valuable resources that you all provide for many providers here in North Carolina and in South Carolina.
Thank you.
Thank you so much for all you do. And I really foresee us being able to connect in 2021 to do all to help us and with 10 at the top with our senior issues.
We'd love to.
Very good. Very good. Now, did you want to introduce any of your staff members? And
You know what? I'm not as, there are some, you know, I'm a person who knows my strengths and knows my weaknesses, and they are my strengths, and I'm going to let them do it. And I'll go with Shannon, Judy, Courtney, Kathy, and Julia. And you go right quick and say a couple things about yourself. Thank you.
Sounds great. Thank you so much, Tim. And I think probably at this point, you know, I was thinking as you were speaking about all of the different ways that we help our members, which ultimately helps patients and families all across the state. And my role with the association is Vice President for Hospice and Palliative Care. And we can talk more about that, but I was thinking specifically about education right now. And one of the ways that we assist our membership, and members and non-members are able to attend many of our education offerings, but it's very important for us, and this time of year is a time where we're setting educational priorities, and then for 2021 hoping to set up educational opportunities that help our members, that we know the educational needs that are out there, and we're able to provide timely and relevant wonderful education, and in the midst of a pandemic to be able to do that in one of the best, in my opinion, best virtual formats that I've seen. So I think we're doing a great job with that. And so I want to turn it to Courtney Hodges, who is going to be able to tell you a little bit about her role, and also to be able to show you through screen share, actually be able to see the website so you could navigate that after today's session if you wanted to go and check that out.
Absolutely. Thank you, Shannon. Thank you, 10 at the top, for having us. We're very excited to be a part of your group meeting and working more closely in the future. Thank you, James Bennett, for referring us. And as Shannon mentioned, this time of year is when we really do our planning for the upcoming calendar year education. As we all know, COVID has forced us to get really creative in the delivery aspect of our education. And luckily, the North Carolina Association, which we're also a part of, we launched our first virtual conference back in September. So we have taken that for a test run. So we're using the same platform for the South Carolina annual conference. So all the kinks have been worked out, and we are just ready to welcome members and non-members alike to come and try out our education. So I'll go ahead and share my screen. First of all, I just want to drive you to our website. Our website is schcha.org. Also of note, November is Home Care, Hospice, and Palliative Care Month. So we are celebrating all month long. The governor has proclaimed November as Home Care, Hospice, and Palliative Care Month in South Carolina. We're very proud of that. And if you click on that first banner that I was just on the homepage, it'll bring you to our resource page. We also list our national partners who also share information about this special month. Veterans Day, as you know, was yesterday. So we do a lot of outreach in that regard. I want to also highlight our resources tab. We have resources for consumers, providers. more information about what home health, hospice, and home care are, emergency preparedness resources, COVID-19 information that we keep our members up to date on. Locate a provider is really important. This is where we house our member directory. So as you're working with members of your community, and as there is a growing need for healthcare at home services, we just want to point you to our directory, because this is where you can go find all of our members listed by county based on either home care or hospice services. So just wanted to point that out to you. But as far as our conference, this is our conference website. You can also get to this from our main website, but the address is schchaconferences.com. I'll put all this in the chat, so don't worry about memorizing it. But when you get here, this just gives you an overview of our sponsors. This is our chairman of the board, Scott Levy. He's inviting everyone to come and check it out. We have a really great keynote starting out, and it's called Spark Talk. Spark stands for Service, Purpose, Resilience, and Experience. Ooh, that's my dog, sorry. and they're really going to be reviewing the perspective of patient and of caregiver. And there's actually a sample of that talk on that website. So you can watch just a little sneak peek of that. We have David Rendell, who is an author, speaker, comedian, and athlete. And he's an international speaker, and I believe international trips are put off for the time being, but he is just so energetic and innovating, and it's really going to be a great way to kick off our first day of our conference. And then we have Bill Danby, who is the president of the National Home Care and Hospice Association. He delivers our national update for all provider types. And you just really don't want to miss that. I also want to point out that if you work with the South Carolina Department of Health and Human Services, that they will be speaking and providing a South Carolina Medicaid update on Thursday, December 10th. And if you scroll down here, you can see this session. So it'll be at 11 o'clock. Anyway, all the details are on this website. I won't go through that, through the details much more, but you can register online here. Check out our brochure. You can download it. You can flip through it here on our website. And there's really something for everybody. We have Dr. Franklin with the Charleston VA speaking. I know Shannon can probably elaborate more on that session. We have our very own staff member, Kathy Smith, is doing a session on an introduction to coaching supervision and how important that is in home care. Really getting down into the weeds of some regulatory and compliance for all areas of healthcare at home, and telehealth, which has been really big in our industry, especially with COVID. It's really ramped up in the last few months. So there are a lot of questions surrounding telehealth, the use of it, the legality behind it, compliance, and that sort of thing. So we really try to incorporate that in our conference lineup. And for general education, you can go to our education tab, click on upcoming events. You can see all the webinars we have coming up. We're also proud to partner with the Hospice and Home Care Webinar Network, and they are a separate entity that we partner with, and they do 10 webinars a month, it must be, for all disciplines, all various topics, conflict resolution. You can see here we have Medicare Advantage and Hospice. They just released their 2021 topics as I'm scrolling through here. It wasn't up there yesterday. So just, I don't want to overwhelm you, but just suffice it to say that if there is something you need to know about home care and hospice, we're a great place for you to turn to. And we're happy to partner with you on education topics. We are really good about partnering with law firms and local regulatory bodies and state and federal experts on issues that affect you and your care team, and your community stakeholders. So please let us know if we can be a resource as far as education goes. And I'll send those websites in the chat. And I'll turn it back over to Shannon now. Sorry about my dog.
Thank you so much, Courtney. And that's exactly right. To me, what this is about building relationships, not for a need that may exist right now. It may be, but it may not be. what's more important is knowing that you can reach out at any time if you have questions or if we can help, and knowing about that resource directory and those all the resources on the website that are open, to non-members. So those are great resources to know about when and if they're needed. And education is critical. It's so important. Our members, as an association, we're there to support them, and often, lots of regulations, lots of rules, assistance with interpretation and understanding, or maybe members determine that there's something that needs to be answered, a question related to a rule. So they give us good information to then go and advocate on their behalf and to help to gain a better understanding related to those rules, regulations. And oftentimes, it's not just a federal regulation. Then it's about, what about the state rules and regulations, and looking into more of the state's perspective, sometimes even more of local perspective. So the association is there to help them all throughout those interpretations and helping to answer those questions. That's what we're here for. And ultimately, that means that we're helping them to do their best job possible for all those patients and families that they're working with and the clients that they're serving. I think I'll turn it to Judy real quick. Judy, just to introduce yourself and tell them your role. And Judy is awesome.
Hello, everybody. Judy Penn. I'm the Chief Operating Officer for the North and South Carolina Associations. And as Tim reminded me, I've been here longer than dirt. I think it's been almost 30 years. I kind of grew up in this association, but I started out my career in healthcare actually as the director of a United Way funded adolescent clinic that did physical health and mental health care for teenagers. So I did that for 8 years in North Carolina, dealing with every issue that a teenager could deal with, and then ended up on the home health, home care side, which is very different because obviously, the majority of our population is the elderly. So I went from adolescent issues to dealing with elderly issues. And the reason I knew that I was in a different world, one of my first jobs as in my new position was to welcome all of our vendors at our annual convention. We had a big trade show and we had vendors that were medical suppliers and consultants and software folks, and the executive director at the time said, Judy, just go around and introduce yourself and start meeting our business partners and our vendors. So I was doing that, and it was fun. There was a great celebratory atmosphere, and I went up to one vendor and I said, hi, I'm Judy Penn, and introduced myself, and he said, hi, here, smell this. And he pushes in my face this Petri dish. And my first reaction was I backed away. And I said, why would I want to smell that? He goes, it's only simulated urine. Smell it. And I was like, why do I want to do that? He said, because I want to show you that the deodorizers in our adult diapers really does work. I was like, wow, I'm not in adolescent medicine anymore. Okay, very different. So anyway, and I never turned back from that. But anyway, we have enjoyed a great relationship with the South Carolina Association since about 2005, and we look forward to many, many more years. And like Tim said, we were supposed to be in Greenville come early December at the Weston Poinsett for our annual conference, but that has turned virtual. So I believe we'll be signing another contract there in a couple of years. So anyway, but I'm going to leave it, to go on to the professionals. So Shannon, who is our VP of Hospice and Palliative, but I see Kathy Smith, our Vice President of Home Care, has joined us. So Kathy, I don't know if you want to introduce yourself to the group and tell them what you do.
Sure. Hey, everyone. And I did want to tell you that I really liked your logo. I really looked at that, and just looking at that visual, I could tell where you were located in South Carolina, and the TTT and the 10, and then the South Carolina shape. So it's such a good visual if someone, was wondering what it was. So I just wanted to compliment you on that. That was a neat logo, whoever designed that. So my name is Kathy Smith, and I'm the Vice President of Home Care and State Relations at the Association for Home and Hospice Care and for South Carolina Home Care and Hospice Association. I'm a nurse, and I have been with the association since 2004, so almost 17 years. And prior to working here at the association for the last 17 years, I worked for our North Carolina Medicaid office under the Department of Health and Human Services, and there was a home care policy section. So I wrote a lot of the policies that affect for our home care sections over at Medicaid that pays for home care, whether it's private duty nursing or personal care services, home health, whatever the various services were. And then prior to that, I worked for a hospital-based home health agency. So I've been in home care since 1990. So most of my career has been in home care, either as a provider or as a regulator, or now at the association, sort of in between both, as a liaison, you could, so to speak. But my main goal and my main objective of what my role is at the association is education. I provide educational newsletters with a test and a certificate for all of our members every month to help meet their education needs for their in-home aid staff. I'm the primary nurse planner at the association for home care and the Home and Hospice Care Association of North Carolina, jointly provided with South Carolina, to provide the approved nurse contact hours for nurses to get their professional development that's required. So doing all things with that, with planning with our team of nurse planners, which Shannon and Sandy, who's not here today, is on our team, and other members of our staff that formulate that team. We have professional development committee in North Carolina and South Carolina. So the South Carolina Professional Development Committee, for instance, met with us, with our team, and developed the educational needs for South Carolina providers. And then that's how we formulate our committees. We do it based on what our members are telling us the need is for the education, along with literature and best practices and what we're finding. And then we provide that education in a way that meets the nurse contact hour requirements through the American Nurses Credentialing Center. There's a lot of paperwork and a lot of rules involved with providing nurse contact hours. So that's my role as the primary nurse planner there. So I do a lot with education, and then have worked with South Carolina DHHS, with Candace Smith-Bird and some other folks over at DHHS when there's some issues that may come up or we ask questions. They are going to be speaking at our conference this year, the conference that Courtney just mentioned to you that I would be speaking at. We also have South Carolina DHHS will also be there to speak about the community policies, home and community-based policies, their manual, and some recent updates to that. So that's my main role, in answering questions and all duties as assigned. So it's so nice to meet you all and to be here with you today. And so we got a rainy day here. I don't know about you guys, but we really got rain and wind here. So
Kathy, can you go ahead and just intro into Julia?
I sure can. So we'll go right into someone who is just so integral to our association, and I work very closely with Julia Adams Sherrick. She's our interim vice president for government affairs and public policy. So all things legislative and assisting in all that regard. So Julia, take it away.
Hi, everyone. So I'm Julia Adams Sherrick. I apologize. My cat was screaming, so she may jump back up here in a minute, and we may end up getting to see Nova, which is a rare occurrence. But I do work on government relations. I've been in the government relations field since 2004, much longer than I'd like to admit at times. I started with the ARC of North Carolina in North Carolina as their Director of Government Relations in 2007, working primarily around Medicaid healthcare policy, home and community-based support for people with intellectual developmental disabilities and behavioral health care. And also worked with our CAP-C program in North Carolina for complex medical care children, and also our CAP-D program, all of our 1915C programs. I also track all of our federal legislation, and since March have been doing a significant deep dive on all things COVID-19. really trying to hash out how COVID-19 waivers are impacting North Carolina, now working very hard on how they're impacting South Carolina, trying to give a path forward for what we expect with new administration in Washington, D.C. around COVID-19, around the public health emergencies, around any additional flexibilities that we may see coming out of the federal government from either the HEROES Act or whatever the Senate puts forward in the next few weeks in the event that the Senate majority chooses to do that. I'm also work very closely with Matt Wolf, who does a lot of legal work in North Carolina and is also on our government relations team. I am in my last year at Wake Forest School of Law, Wake Forest University, where I will be graduating in May 2021 with a degree, a master's degree in health law, health policy. And so I'm kind of also the girl who spends the time listening to the SCOTUS arguments and then saying, I think we're okay, or I don't think we're okay. So I do all of that. I did notice that a message did pop up in chat about what we were looking at. And I can tell you that South Carolina and North Carolina, sisters across the states, a lot of the issues we see are going to be the same. The need for direct support professionals. How do we retain them? How do we recruit them? How do we make sure that the wages that they are paid make them stay with us for the long haul? How do we handle COVID-19 changes, PPE? What do we look at when we're looking at PPP in the future? And also looking a lot at, any kind of flexibilities that we can make permanent that we have found are positive through all of this, including some of our private duty nursing. I am new to South Carolina, and so I am working with our lobbyists on the ground there to learn South Carolina. And as Tim Rogers had stated, we are going to start a meeting about what is needed. And I'll make sure that I take your notes here about what your top priorities are to that group when we meet. And I'm here to answer, the federal questions today, if anyone has any that they need to ask. It's nice meeting all of you.
Well, very good. Shannon, go ahead. I'm sorry, I cut you off.
Oh, no. I was just going to highlight one other program that we have really worked on this year. We are a hospice veteran partnership. Through the National Hospice and Palliative Care Organization, We Honor Veterans program. And I just thought it would be a great thing to highlight that this year, the association actually received a grant for trauma-informed care for Veterans on Hospice initiative. And overall, the We Honor Veterans program, we want our hospices to be able to provide the best care possible to veterans, especially at end of life. And we support this program that's through NHPCO, and we are a recognized hospice veteran partnership. And so in getting this grant this year, we were able to do some wonderful education offerings, and we opened those up to anyone that wanted to attend, whether or not they were members or not. And we continue to have hospice veteran partnership calls. We're hosting those. We're trying to do those monthly now. And so if anyone was interested in participating in those calls or being a part of our hospice veteran partnership, all you have to do is let me know. You could send me an email, tell me you want to be included on that distribution list, and I'd be glad to do that. But it's just another way that we're supporting our members to ultimately support those patients and families the best way that we can. And we're real proud of our work on our hospice veteran partnership and all of that work that we've done this year and continue to do in 2021.
Well, again, we certainly thank you all for participating today. And I don't know if there's any, I can't see the agenda now, Justine, but I guess it's now we'll open the floor up for any questions for anyone. If you so desire, you can unmute yourself and ask the questions, or you can put it into chat. There's been a lot of activity on the chat. There are some questions about some of the priorities from the legislative priorities. Shannon, do you may want to cover some of these for those who may not have the chat feature? They may be on this meeting via phone and not able to see. But are you able to cover any of those priorities that the association is trying to address within the next year or so?
Yes, and I'll work with Julia to make sure that we do that. A couple of the chats for those that cannot see it, one of them is expressing appreciation for hospice care for a family member, and I appreciate that. And I will say that from coming from working in a hospice, it meant so much to be able to provide that care. And now from an association perspective, to be able to support all those members that are doing that wonderful work out in the communities, I wouldn't want to be anywhere else. It means a lot to me to support them to be able to do that work. So thank you for that. And also us continuing, we'll continue to be a resource even after this call. So if folks have questions or want to reach out, the website, Courtney, there's a staff directory page there too that has our bios, our pictures, and our emails. So that's probably a good way to connect with us afterwards as well if you need to. So Julia, some of these questions related to more specific legislative, let's go back and see if we can.
Yeah, what I read, thank you, Shannon. What I read was one of the legislative priorities that I'm seeing here is requiring care services to increase the number of Medicaid beds. As of 2015, the state, we were woefully short of needed beds and there was no relief in sight. And I'm assuming that that's relating to the hospice beds. Is that correct? Whoever asked that, if they could just give me a number.
No, facility beds.
Facility.
My sister was told to be non-weight bearing to go into a facility. It took us from that point, I think it was close to 3 years, and she went from being on the waiting list. We went to just about every nursing home to get her in, from like 34 down to 31 in a matter of almost 3 years, because there's so few beds in South Carolina, because we didn't accept matching funds, that the availability, when they come available, they usually go to somebody in that home who has run through their funds. So you really, unless you get into a 3 midnight situation in a hospital and get sent to a Medicaid bed, your chances of getting in are nil. So the financial responsibility falls on the family. And what we found with doing, which one of the premier, and I won't mention the name of it, in-home healthcare services, where we had marginally and or mentally ill people show up for her care, somebody on drugs who stole her drugs, people, it would be in a given week, she had 3 days, she would get a couple of hours. We finally got up to, she would be sent different people, and there was no continuity. And so she was constantly having to explain everything all over again and nothing getting done. And so my other sister who had a stroke and came out of one of the top, I think it is the top rated rehab facilities in Greenville, we accepted their in-home care it was a transition period. Because it would be continuing to, we screened in the same thing. I think she got, in a matter of about 6 visits, she got one that was therapy. The rest of it is people, this person's not here anymore. And so we sent this person, they have to evaluate and we have to go through everything again. I mean, it was so frustrating. And that is like, for all the organization you have on the top, if you can't deliver to the person who needs care, it's worth almost nothing. And that, I mean, we've had over several years, a lot of care with 3 different individuals in our family. And I can't say, the only thing that I can say that I really would give high praise for was a hospice, which was phenomenal. And I had hospice care for myself for grief in Connecticut. And then we had hospice care in North Carolina for my sister, who was dying literally from neglect in a previous nursing home. And the nursing home we got her into was fabulous, but it was just too late. So our family experience with care services has been beyond abysmal. And some of these things are supposed to be top facilities, and and we're highly educated in a medical family, which is really disturbing.
Thank you, Sue, for clarifying that, because that helps me a lot. I do not have any answer for you on if that was a priority, but if you wouldn't mind, I can do some research with the South Carolina team, since I'm new to the South Carolina team, and see what they have been working on a statewide level, and then we can respond to your question.
Yeah, I just don't know if it's changed. I know it was because we denied the matching funds for Medicaid beds, which just literally, and I know when we would contact nursing homes, they would express huge frustration with the fact that they weren't allowed to add one more Medicaid bed.
Right.
Because the funds were not there and they weren't legally being allowed to do that. And if you don't have that, then you have people who can't afford the services they need. Thank goodness there was money within the family that was able to help my sister, but it shouldn't have been on their backs to do that. And the care we got was beyond abysmal. We finally, in the last, I think, 4 months of her life, were able to get a woman who was here, and she actually was a registered nurse, but she was having moved from out of state and was going for registration here. And she came and stayed, and she was phenomenal. But that was the only person that we had that was really any good ever.
Thank you for sharing that. Yeah, if you wouldn't mind if I could take that back to the South Carolina team, the lobbying.
Yeah, absolutely. Yeah.
A review of what they had been working on with that, and see if they have any insight into that.
Yeah.
Thank you.
And Julie, I was going to add too on that topic that I know from an association, this is just an example of how we know how important that continuity of care is, and recruitment and retention is a topic that very often does come up within our membership. So we work very hard with our educational unit to try to get speakers that ultimately can be beneficial to all of our members to talk about recruitment and retention and ways to help in that respect. So I just thought about that as that topic was mentioned, that's another way that while we may not be in those organizations, we're doing everything that we can to support them with strategy, education, knowledge that can help them in that area.
I don't think it's going to change actually until we have a living wage for these people.
Right. I was going to say
Because I
that
don't think you're
reinforces.
able to hire people who are up to the job.
And it's interesting. Yeah, I mean, I definitely agree, because one of the interesting things that we're watching right now is, strangely enough, Florida just passed a $15 minimum wage amendment in this last go around on November 3rd. And a lot of us are now looking at other southern states to see if they will take Florida's lead, because you're absolutely correct. If we cannot pay a living wage, and if we can't offer a path forward to even higher career goals with direct support professionals, right? This is your entrance to a full career. Then we are always going to have this incredible high staff turnover. And that is a problem that we see across I mean, Kathy is an expert on this too. This is something that we see nationally. Every single state is grappling with this same issue. And COVID-19 in so many ways has really amplified this issue, right? Because so much of our resources got upended when COVID-19 started, and states had to do rolling shutdowns, and folks had to all come home, and kids had to come home, and that just put another strain on top of this workforce of how do you do this job during a pandemic. And we've seen we'll probably see when we start to really research it nationally, a higher turnover rate because of the pandemic.
My hope is that it's going to point out the weaknesses in such neon lights that people actually finally do something about it.
And I think we will. And I think it gives all of us an opportunity when we're advocating in South Carolina and North Carolina to really point to the importance of having more home-based community services outside of our institutions, so that we can better control the pandemic and the outbreaks. And also really acknowledging, I know in North Carolina, our legislature did a COVID-19 task force that really talked about the importance of direct support professionals. And I think they understand it. And we hope to take that and layer that message into South Carolina too.
Well, please understand this is not a criticism of what you're doing. You're all doing the right things. But if you don't get the contact level of people and get that working, then whatever you do at your levels is not going to be really productive in the long run. It really has to be where they're paid more and all of those things. And I don't know how much of that is even in your control, but what's happening on the ground, level is just abysmal. And we've had several years of experience with it in more than one state. So North Carolina and South Carolina, actually.
We hear you. Thank you so much for sharing your story. We really appreciate it.
Thank you, Sue, again for providing your comments and your feedback today. We could really probably talk another 30 minutes on these issues that surround the seniors in our community, and doing all we can to provide them with the care that they need in their home and the care that they deserve to receive in their home. But we're grateful that the South Carolina Home Care Association, Hospice Association, are working with legislative and also other organizations throughout North Carolina and South Carolina to do all we can to help with providing that continuity of care. And I can be a witness and speak directly to some of those issues that you experience, Susan. I certainly know exactly where you're coming from. And again, we want to do all we can to help provide the excellence of care that our seniors deserve. So again, thank you all for being on the call today. We have about 5 minutes. I don't want to keep you long, but I want to turn it over to Justine to give some final remarks and announcements of some things that are happening at 10 at the top.
It's a clarifying question in the chat box. Do you mind? I don't mean to interrupt, but
Please.
I don't want to leave a question undone if we can. Bill, what kind of is it? Do you want to know about education in general or about an educational idea? I'm just trying to think of, I see you were asking about education, and I want to make sure we answer that.
Yeah, I wanted to know who in your organization is the right person to approach to talk about educational programming ideas.
Oh, okay. Why don't you just reach out to me? And
okay.
I'm going to type in my address here, because we have a professional development committee that works on education, but we meet and talk. So just send it to me. That'll be fine, and we'll correspond. But let's see. Yep, I just put my email address in there. Do you see that in the chat?
Yes. Yep, I got it. Thank you.
All right. Thank you, Bill. I'm sorry I didn't mean to interrupt, but I didn't want a question to go unanswered. Thank you.
No, you're fine. Thank you for pointing that out. Are there any other questions or anything before Justine moves on?
This is Shannon. The only other thing I'll mention is if you do go to our staff page, you will see Sandy Decker is our Vice President for Home Health Regulatory and Clinical Affairs. She could not be with us today, but I wanted you to know that she is our Vice President, Home Health Regulatory and Clinical Affairs. And if you go to that staff directory, you can see her, and her email is also there. Thank you.
Okay, very good. Justine?
Thanks, everyone. Thanks, Kathy. I saw that and I thought that looks like a complicated question. I was going to throw that out to you all, so I appreciate that. And special thank you to Shannon for getting everybody here today. We really appreciate learning so much about everything you do. Well, I could stay here forever. It's been really fascinating. I just wanted to give a couple 10 at the top updates. We have a couple events coming up next week. Our celebrating, I'll go ahead and put it in the chat here before I forget. Celebrating Unsung Heroes event that is next Wednesday. I've got the registration and some more information in the chat. And then our every other week we have a chat, so anyone's welcome to come. Myra Reese is speaking from DHEC next week, and those are just an hour of some good information, some county updates, and a chance for people to actually have a little social time before too. So that's it for me. Thank you so much.
Okay, is there anything else that, any other topics or anything, any other questions that need to be brought up for the good of the group?
Looks like there's another question in the chat about marketing.
Yes, hi. Can you hear me?
Uh-huh.
Okay, yeah. So my name is Haley Olsen. I live in Anderson, and I have recently started a senior home care business. I am DHEC licensed, and with COVID, it's been a little challenging for the marketing piece. And so I just wanted to get some input and to hear what I could do despite the COVID issues, trying to get the word out.
Haley. This is Courtney. I missed the whole part about introducing what my role is when I do at the association. I missed that memo. So I'm the Vice President of Marketing, Communications, and Events. And so what I'm proud to say about our upcoming conference is there are sessions about that very topic. There's a session on how to engage your marketing teams in a virtual way, how to access referral sources and engage with your community, maybe your senior centers, or people like this group, like you're doing now. So there are tips in that regard, and I'm happy to connect with you one-on-one to share more tips and tricks and ideas. Just I know in the interest of time, but I put my email address in the chat box, so please reach out to me, Haley. I'd love to talk with you.
Okay, I will. Thank you so much.
Sure.
Thank you for catching that. I didn't see that question, but thank you for pointing that out. Okay, well, it's approaching right at 2 o'clock, and we again want to thank the South Carolina Home Care and Hospice Association for all that you are doing throughout the state, and thank you for participating in this senior issues workshop. And I'm sure this will not be the last time we hear from you all. We're looking forward to working with you all in 2021. And again, thank you for all that you do. Thank you for everyone that is on the call that has participated for today, as well as supported 10 at the top in this senior series workshop throughout this year. And we'll hopefully be able to have these go back to having in-person meetings, but we'll see. But we'll certainly utilize this format as much as we can to continue to fight the good fight and to continue to spread the news and to connect and network, to do all we can to help our community. Okay. Well, if there's nothing else, again, I thank you all for participating, and I hope you all stay dry because it's raining here in South Carolina. And again, we appreciate everybody's participation.
Thank you. Thank you so much for all you do. Thank you. Nice to meet everybody virtually.
You too.
Bye.
Bye-bye.
Bye.